Good afternoon. Greetings, a message to all of our patients at RBK Pediatrics and all parents of pediatric patients anywhere around. This message is out of love, affection, and also some concerns about our pediatric patients. So, foremost, I hope that all of you are doing well during these very difficult times. I want to touch quickly a few things that are extremely important. Foremost, let me congratulate all parents, all students, all teachers, all administrators in school who have done so well with distant learning, something that they were not trained, something they had never done before, and they did very well for their students, and they continue to do well. There are obviously shortfalls that occur during this. The learning cannot be the same as it is in a face-to-face classroom setting. Distant learning puts a lot of burden on the parents. Most of them did very well. The kids staying home have not only had cabin fever, but there are signs of mental issues that either have already cropped up or are bound to crop up as we go along. I have a feeling that school reopening has not been addressed sufficiently by the Corona Task Force or by the local and state and federal governments yet. So I expect that down the road there will be some problems with the kids once they go back to school. Hopefully they will go back to school when all the parameters have been met and they are 100% sure that there is no danger to the children. Signs of anxiety, signs of depression have to be looked at, something the parents have to be aware of, especially in the age of 5 to 10 years. In the older kids, up to 21, look for signs of depression also, but especially any suicidal thoughts and tendencies. Not only you are locked in, the problem is when a family member has passed away because of the virus or has stayed in the hospital 3 to 4 weeks because of the sickness and has come back home and continues to be still fatigued, tired, and sick. So the effect on these, on the parents, but especially on the children, is tremendous. And this comes out through the questions they ask. The second point that I want to make is a little turn in events in the disease process. Initially, our feelings were that practically no kids are going to be affected by this, but with time, we saw some cases, and now we have seen a significant number of cases of multiple organ inflammatory disease where the coronavirus has come out positive in these kids. These kids can be very sick. They have fevers. They have abdominal pains. They have rashes, sometimes extremely severe rashes, and hypertension. They go into multiple organ involvement like the heart, the kidney, the skin, the neurological developments, and this is something that the parents got to be aware and not take it lightly. Whenever there's a fever beyond a couple of days, you have to get attention. You must bring them to the doctor or the emergency room and ask for not only being examined, but also do the necessary tests and look for the inflammatory markers in the blood tests, which includes the C-reactive protein, sedimentation rate, CBC, etc. That has to be looked at, because this syndrome, this new development, is affecting almost all the systems, and there have been some deaths also. The third point I want to make is, while we were in the lockdown, a lot of the routine visits and routine vaccinations did not occur. So I want to let the parents know that we do not want to have another crisis at hand. We do not want a measles outbreak. We don't want a meningitis outbreak. So time to start scheduling those routine visits and do the catch-up on the immunizations. I know nothing is easy, but together